Let me talk to my colleagues today. This is very important and I want you to have a listening ear. Sometimes when you are sick and when you seek medical attention in any facility in any country, we get good knowledge and explanation from our medical personnel. All health workers attending to us, they do a very wonderful job that each and every patient normally becomes happy. Clients are very happy because they have been treated with a great care. But there's something that most of us are not aware, that they are doing something which is wrong, which they should change. As you watch this video, sometimes you might be doing it, but you do not know that you are creating a great harm to your clients. You are creating a great harm to your patients. This is the use of medical jargons, big medical terminologies that our patients do not understand. Now, I want to impact this piece of information to all healthcare providers, that whenever you are talking to a client, whenever you are talking to a patient, kindly avoid medical jargons that may confuse the patient, that may cause psychological trauma to this particular client or to this particular patient. Try as much as possible to use simple words. Use of simple words are what is going to encourage this patient to adhere to your drugs, to listen to what you are saying, and to make your management be easier, because almost 95% of managing of patient is communication skills. Try to understand your patient, try to talk to your patient in a simple way that a patient may be able to understand. If you are using big terminologies that a patient might not understand and might even get confused, try to explain this even by using diagram, by using what you learned in college in terms of anatomy and physiology in a diagrammatic manner, and show this patient each and every step of this pathophysiology or this physiological process or this pathological process that happens in somebody's system. For example, you may use simple words. If a patient has ear infection, do not go ahead and say, my dear, you have otitis media or you have otitis externa, or maybe an old man comes with a problem of the back and now you bring your medical prowess and start saying that you have lumbosacral osteoarthritis combined with sciatica. This might confuse the patient so much, and this may make the patient to develop what we call psychological trauma, psychological disturbance, and some may even end up developing psychosis because of this your medical jargons. So let us use our communication skills wisely by empathizing with our patient, by having what we call a listening ear. If a patient comes to you, do not rush into the diagnosis and confusing the patient with big medical jargons. So this is a big challenge to all of us, and we should change forthwith. If you love this my channel, and if you love what we are doing in this YouTube, please click this notification bell, written subscribe, turn it on for more videos that we post. And all medics and all health practitioners, let us use simple words and let us avoid medical jargons. Otherwise, muchas gracias.